Excuse me. Newborn adaptations continued. The immune system. Most of the circulating antibodies are IgG, and they're transported from the mother across the placenta through passive immunity. They are at risk for infections. Early signs of infections must be recognized and treated. Temperature instability or hypothermia as opposed to hyperthermia in an older person. They do not typically exhibit fever, although hyperthermia can occur. Lethargy, irritability, poor feeding, vomiting or diarrhea, decreased reflexes, and pale or mottled skin are some of the clinical signs of infection. Respiratory symptoms can include apnea, tachypnea, grunting, and retracting. The integumentary systems, you'll see some newborn adaptations such as vernix caseosa, sweat glands or the milia, desquamation, Mongolian spots, nevi, and erythema toxicum. And the next two slides have photos of those so that you'll be able to recognize them. In addition, there is a slide with forceps marks on the baby. I think there's a vacuum one too. Yeah. Further adaptations, signs of risk for integumentary problems are pallor and plethora, petechiae, central cyanosis, jaundice, forceps marks or other lesions related to fetal monitoring, such as the fetal scalp electrode that's applied to the scalp, and bruising. In the newborn's reproductive system, in the female, there can be a mucoid vaginal discharge or pseudomenstruation. It actually looks like the new baby girl is having a period, but it's only the result of maternal hormones. External genitals are usually edematous with increased pigmentation. In term babies, the labia majora covers the labia minora and the clitoris. In the premature babies, the clitoris is prominent and labia majora are small and widely separated. Vaginal or hymenal tags are quite common in newborn baby girls. In the males, foreskin covers the glands completely. The urethral meatus should be at the tip of the penis. Testes can be palpated in the scrotum, which have rugae covering the sac or the lines. And you need to make sure you palpate both testes. The scrotum is more deeply pigmented than the rest of the skin. A bluish discoloration of the scrotum suggests testicular torsion, which needs immediate attention. In other words, the testes are twisted inside the sac. Swelling of breast tissue, again, is a result of maternal estrogen levels. Signs of risk for reproductive problems are ambiguous genitalia, hypospadias or mal-descended testes. Circumcision is contraindicated when hypospadias is present, and inguinal hernias. On the next slide, you'll see a picture of an example of hypospadias, where the urethral opening is not located at the tip, it's below. And there is such a thing as exstrophy of the bladder, where the hypospadias is so severe that the bladder is actually on the external surface. The ambiguous genitalia, it's indistinguishable whether the baby is male or female, and usually genetic testing takes place for that. In the skeletal system, there can be molding of the head, otherwise known caput succedaneum, generalized edema of the scalp, most commonly found over the occiput, as most deliveries are cephalic. Cephalhematoma is a collection of blood between the skull bone and its periosteum, therefore it doesn't cross the suture lines. Those are the key defining factors. The caput is of the scalp and can cross suture lines. The cephalhematoma, or the collection of blood, does not cross suture lines. It's from one bone. And the next slide has a picture of caput and cephalhematoma. The extremities should be symmetric and equal. Developmental dysplasia of the hip is tested by Ortolani's maneuvers, and we'll review that in class. The gluteal skin folds when the baby is on its stomach, the gluteal fold should be even and symmetric. The legs should both be equal. Failure to have equal or gluteal folds or equal leg length can indicate hip dysplasia. In the neuromuscular system, newborn reflexes are present. There's many which we'll review in our class. Signs of risk for neuromuscular problems. Any absence of newborn reflexes can indicate major neurological problems, and birth trauma can cause nerve damage results in facial asymmetry and paralysis, such as Bell's palsy. Central nervous system depression from maternal medications can influence neuromuscular functioning, so you need to be aware of what medications mom received during labor and delivery. A weak, high-pitched or shrill cry can suggest central nervous system abnormality. In transition to parenthood, this is a time of disorder and disequilibrium as well as satisfaction. It's a whole new thing, a new situation that throws them into a little bit of distress. Usual methods of coping often seem ineffective during this time. Strong emotions such as helplessness, inadequacy, and anger arise when dealing with a crying infant. And be prepared to teach mom how to deal with that. Parental tasks and responsibilities is to reconcile the actual child with the fantasy or dream child. Everyone has a picture of what their child will be in their head during the pregnancy, and it may not match what actually is delivered. Parents need to become adept in the care of the infant, and they have to establish a place for the newborn within the family group. Everybody must adjust their roles to accommodate for the newborn. Everybody has to shift. Assess the newborn and mother, and again, we will go over this in class. We're going to look at their general appearance. Check their vital signs, including their weight and length. When we're checking vital signs, we want to check their respirations first so that not to disturb them and have them start crying. Then it's almost impossible to check. Baseline measures of physical growth such as head circumference and body length. Neurological assessment or just checking the reflexes. A gestational age assessment. Airway maintenance. Maintaining adequate oxygen supply. Maintaining body temperature. Eye prophylaxis with usually erythromycin. Vitamin K prophylaxis to prevent any kind of bleeding. Initial assessment includes Hep B immunization and umbilical cord care. Now that varies from institution to institution and from time to time. Current recommendations by American Academy of Pediatrics is that we don't need to do anything, although most nurses and facilities feel like they need to do something, so they'll do alcohol, and some facilities may even apply antibiotic cream ointment to the stump once. APGAR scoring is usually done immediately after delivery, and that's an assessment of how well the baby has transitioned through the labor and delivery process and adapted in the first 5 minutes of life. It's done at 1 minute and 5 minutes after birth. Newborn hearing screening is done just prior to discharge to assess if there's any kind of hearing loss. Venum punctures and urine specimens, if needed. Venum punctures will be done you can check bilirubin, blood sugar, and then the metabolic screenings that's required by state laws. Urine specimens may be required for tox screens or septic workups. Circumcisions, if everything's normal and the parents have signed a consent. Again, there is, by American Academy of Pediatrics, is not necessarily recommended. They sort of have a neutral position on that. Want to make sure you assess the family interactions and adaptations to a new family member. In terms of infant nutrition, we'll discuss breastfeeding and formula feeding in class, and just be prepared to discuss the advantages and disadvantages of each one, including cost, convenience, and nutrition for the baby. Aloha!